वेलकम टू जी मनी हेल्थ शो। आई एम नेहा बजाज और हमेशा से अपने शो पर हम आपको मिलवाते हैं मेडिकल एक्सपर्ट्स और सुपर स्पेशलिस्ट से। और अच्छी सेहत हमारा वादा, यही तो है हमारा प्रॉमिस जो आज हम आपको कर रहे हैं। और आज हमारे साथ हमारे शो में जुड़ रहे हैं डॉक्टर मुनीश्वरा जीबी, जो कि एक ENT सर्जन है। पिछले 25 इयर्स से प्रैक्टिस कर रहे हैं। डायरेक्टर, ओनर, फाउंडर है गनाधर ENT एंड डेंटल क्लिनिक, तुमकुर, कर्नाटका में। देश के कोने कोने से लोग हमारे साथ जुड़ते हैं। सो डॉक्टर मुनीश्वरा, टुडे आई एम गोइंग टू आस्क यू समथिंग जो मुझे भी है और मुझे बड़ी दिक्कत भी होती है। आज हम आपसे बात करने वाले हैं साइनसाइटिस के बारे में, यानी कि साइनस के बारे में। सो प्लीज टेल ऑल द व्यूअर्स व्हाट इज साइनसाइटिस एंड व्हाट इज द रूट कॉज फॉर इट।
Madam, sinusitis is an infection of the sinuses, paranasal sinuses. They are located on either side of the nose.
Okay.
Like here we have maxillary sinus, you have frontal sinus, ethmoid sinus, and sphenoid sinus. So, in simple words, it is infection. Infection of the paranasal sinuses is called sinusitis. So, there are many reasons, like allergy, pollution, even diabetes.
Okay.
Yeah, even virus, bacteria can cause sinusitis.
And so, is there a genetic factor also involved in this?
Very little genetic factors are playing. It is mainly, we call it as anatomical factors.
Okay.
Anatomical means structural. Inside there are any problems inside the nose, then you get predisposed for development of sinusitis.
ओके, तो सर अगर किसी को साइनसाइटिस की एक बार शुरुआत हो गई है, व्हाट इफ अ पर्सन सफर्स फ्रॉम साइनसाइटिस, तो इज इट अ लाइफ लॉन्ग प्रॉब्लम या इट गेट्स करेक्टेड विद मेडिकेशंस और nasal drops?
No, not at all. With the present technology, present medicines, we can almost cure all of them. There is no problem.
So that's a really good news. And doctor, all the people, because I am myself a patient of sinusitis, because every time I feel that my nose is blocked or I need to use nasal drops, which are not advisable in the long run. So please tell all the viewers that what are the precautions, what are the preventive methods, measures that one should take जिसको sinusitis already है.
No, sinusitis prevention is, if you have slight commonest cold is there, little bit of sneezing is there, little headache is there, nasal discharge is there, early stage you visit a doctor or a specialist. Maybe if you give some medicine, simple medicine, it will not go to the full-blown bad sinusitis. Okay. Basically, sinusitis, there are different types like acute, subacute, and chronic. So once it goes to chronic stage, then only operation will come.
Okay.
Otherwise, most of the acute sinusitis we can cure by medicines.
Okay.
So that is very important. So in the initial stage, visit the doctor.
And
if they visit the doctor in the initial stage, we will be able to cure.
Okay. And doctor, there are a lot of people who are kind of addicted to nasal drops because they feel they can't sleep without them because of the congestion. How safe are nasal drops? Because the nose is half of the time blocked.
No, that is not good. If you continue to use the nasal drops, then you develop what is called rhinitis medicamentosa, which is very bad. And you can also get what we call hypertension. Means your blood pressure may shoot up because of the drops. When you put drops, it gets absorbed, and you develop blood pressure in the long run. And overall, nose block is not good for health. The breathing is very, very important. So somebody has to breathe well and sleep well. Means nose has to be very good. So for that, ideally, they should visit a specialist, and we have a lot of treatment modalities right now available. You must have heard about endoscopes. Now we can put endoscope into the nose. We can diagnose accurately, and you can do the surgery. And if it is a surgical problem, better to undergo operation and better to make you all right, so that you don't use medicines regularly.
Okay. And doctor, how safe is this surgery? Because a lot of people are scared कि नाक की surgery है, sinus surgery है, कितनी safe है? Is it life threatening? There are a lot of myths. So I want you to elaborate a little bit on this.
No, all surgeries, will be always an inbuilt risk is always there. Usually in a safe hands, doctor takes care of very well, and usually with the present technology and expertise, usually they won't end up in any problems. We can safely do the surgery. Of course, the inbuilt risk is always there for any surgery, any procedure in the hospital. The risk is involved for the patient, but generally they don't end up in any problems.
Okay. And Dr. Munishwara, what is the age bracket of patients coming to you for the treatment of sinusitis? Like, which age group is more prone to sinusitis?
No, actually, you get sinusitis even in children, also in adults, also in all age group, you will get it.
So it can occur at any age?
Yeah, any age you can get it, sinusitis. But most of the children, if you get sinusitis, usually they reverse by medicines.
Oh.
And in adults and in the middle age, the sinusitis, it may not reverse. But even if you diagnose sinusitis, you are supposed to treat with medicines for not less than 3 months. You have to try medicines. If medicines do not work, then only we can think about surgery. So patient need not get scared as soon as they have sinusitis. Never think that it is always operation.
ओके, सो ऐसा जरूरी नहीं है कि अगर आपको साइनस है तो आपको ऑपरेशन की जरूरत पड़ेगी, और जैसे ही आपको इनिशियल साइंस आते हैं तो डॉक्टर कुछ इनिशियल सिम्टम्स के बारे में भी बताइए. व्हाट आर द कॉमन सिम्टम्स दैट अ साइनसाइटिस पेशेंट सफर्स?
No, most of the time it is nose block, then headaches, then nasal discharge, cough, like that simple symptoms will be coming. So with those symptoms, if you approach a specialist, so they will be able to diagnose the sinusitis with the 2 simple tests. One is called nasal endoscopy, another one is CT scan of the nose. So we do 2 tests, and with that we can confirm that you have sinusitis or not. If you have sinusitis, then the treatment will proceed. We proceed with the treatment, like medical treatment or surgical treatment, like that.
Okay. So, doctor, जैसे आपने बताया कि all those people who have sinus, उन्हें जुकाम रहता है, cold रहता है. So, are these people more prone to viral fever infections?
Yeah, if you have already existing infection in the nose, it get exacerbated with the virus and bacteria. So what happens? Continuously there are some baseline symptoms. Occasionally it can increase and decrease.
Okay.
So better to have healthy sinuses for good health.
Okay. And sir, what are the treatment options, like those who are not opting for surgery? Do you prescribe some tablets, nasal drops, nasal congestion removal sprays, or do you also say that steam is also good for nasal congestion?
Yeah, we have a lot of medicines, conservative treatment, we call it a conservative treatment or medical treatment. Like we give a lot of antibiotics, then antihistaminic, then mucolytic agents, just to make the mucus thinner. We can give mucolytic agents, then nasal drops, nasal sprays.
Okay.
Then we also do what is called saline nasal wash, or ringer lactate solution is there. With that, if you irrigate the nose, all the mucus and secretions will be washed out.
Okay.
And you can improve the sinus health.
Okay.
I am not recommending any steam inhalation for patients. No, I am not recommending.
Okay.
It is not completely studied in medical science regarding the steam inhalation. So I am not strongly advocating steam for patients.
Okay, a proper medical advice and supervision is needed अगर आपको sinus है. तो Dr. Munishwara, it was a lovely session, and हम last question आपसे पूछना चाहते हैं that what are the preventive measures? जितने लोग आपको भी देख रहे हैं, समझ लीजिए मुझे भी sinus है, so I want to know what are the preventive measures, कैसे हम इसे control में कर सकते हैं, या फिर जितनी parents आपको देख रहे हैं उनके बच्चों को sinusitis ना हो, can you just share some tips?
So basically, any organ health, any organ in the body, it is I will generalize my statement. Any organ health, whether it is irrespective of whether it is ear, whether it is nose, whether it is eyes, whether it is heart, any organ health depends on your balanced diet, your hydration, your exercise, your sleep. Like these type of factors also play on the sinus health. That is basics. Apart from that, if you use the mask, you can avoid lot of pollutants entering into your nose. So pollutants also can give rise to development of sinusitis.
Okay.
And if you use the mask, you can also prevent the entry of bacteria and virus and also allergens. So that way we can reduce the development of sinusitis.
So sir, ऐसा भी है क्या कि आजकल के हमारे लाइफस्टाइल में the young generation is always on the phone, sleeping late, waking up late. So do you feel this kind of lifestyle also has an impact on sinus?
Possible, because so once you have reduced sleep, if you have reduced sleep minimum 7 to 8 hours, if somebody is not sleeping, it's called sleep hygiene or sleep right time they have to sleep, right time they have to wake up. If they don't do it, then automatically your body resistance may go down, so you are predisposed for attacks of infections. So that way you can also get sinusitis. So best thing is to they have good sleep hygiene. So if they sleep at right time and get up at right time, I think probably it will help in even prevention of sinusitis.
Okay, very well said. And doctor, हमारे शो में एक segment होता है tip of the day. So all those viewers who are watching you right now, any one tip for sinus that you want to give? Any one tip?
Yeah, if any symptom is there in the nose, like whether it is nasal discharge, whether it is nose block, even by chance loss of smell is there, like smell sensation is reduced, better they should consult the nearest possible doctor. I think instead of taking self-medication, I don't want patient to go to medical store and buy some medicines and put drops. No, that is not good. I advise people to visit the doctor.
Okay, so Dr. Munishwara is strictly advocating against self-medication. खुद से कोई दवाई मत लीजिए, एक एक्सपर्ट से मिलिए, एक सर्जन से मिलिए, एक स्पेशलिस्ट से मिलिए. So Dr. Munishwara, thank you so much for being a part of our show, and you shared so many interesting tips, and I'm sure आपके सारे tips हमारे viewers के बहुत काम आएंगे. Thank you so much.
Thank you, madam.
So ये थे डॉक्टर मुनीश्वरा, जिन्होंने हमें बताया कि सेल्फ मेडिकेशन इज हार्मफुल. अगर आपको अपनी नाक में कोई भी सिम्टम दिख रहा है, नोज ब्लॉकेज है या फिर रनिंग नोज है, या फिर अगर आपको स्मेल नहीं आ रही किसी चीज की, ये लक्षण हो सकता है साइनसाइटिस का. तो देखिए यहीं पर बात आती है एक मेडिकल गाइडेंस की, जो हम आपको देते हैं हमारे शो में, जिसका नाम है जी मनी हेल्थ शो. और कहते हैं ना, प्रिवेंशन इज बेटर देन क्योर. तो प्रिवेंटिव टिप्स ही हम आपको बता रहे हैं. मिलेंगे आपसे अगले एपिसोड में एक नए सुपर स्पेशलिस्ट मेडिकल एक्सपर्ट के साथ. टिल देन स्टे ट्यून्ड एंड कीप वाचिंग जी मनी हेल्थ शो. अच्छी सेहत हमारा वादा. बाय बाय.